Hello and welcome to HealthCast 305. This is your host, Dr. Rob Polzak, physical therapist, owner of Physiologics Physical Therapy. Today we have a special guest in a new category. His name is Dr. Todd Giardina. I think I said that
Yep.
right.
Yeah, you got it.
Uh, he is a licensed psychologist with more than 15 years of experience, and he's very well recognized and acclaimed as one of the few male psychologists in South Florida. So that's a cool thing. Apparently, it's not a career that many guys get into. Um, and so he's a PhD, and he operates out of the Coral Gables Counseling Center. So
That's it.
everyone,
Yep.
welcome, Dr. Todd. Is there anything
Thank
else I
you.
missed there? Any cool bits of information that you'd like to share on
Uh,
top of that?
well, the other interesting tidbits is I'm originally from New Orleans, so I'm not a Miami native. That makes me stand out a little bit sometimes. Um, but yeah, we'll get into it a little bit. It's my career's taken some interesting turns, and I do a little bit of this, and a little bit of that. So I try to be a little bit different than everybody else.
Okay, good. Well, that's a good thing. All right, so let's start off with. I have a little list of questions here because
Sure.
there's a lot of things we get into, and I just wanted to keep myself organized. So tell me a little bit about your practice in particular. What is your practice? How did it start, and all that? What's the focus of it?
Right. So I'm in a group private practice. So I think there's 20 of us in the group at this point, and we try to cover a little bit of everything. I like working with groups because then, you've got a team atmosphere. So if there's
Mm-hmm.
something that my patient needs, then we don't need to farm it out. We've got somebody in house can do it because it does take a team. I've been in private practice, I think, a little over maybe 12 or 13 years now, something like that. But I really got my start working in hospitals. And so I like the hospital team atmosphere. I like the idea that there's parts of a patient's care that I can't tend to. And so I want to have backup. Private practice has been great. It's fun because I make my own hours. It's fun because I get to choose a little bit of who I like to work with. And what I've found is that kind of chose me. I was trained as a health psychologist. I was trained to work in pain management and end of life care. That's really what my course was throughout my education, my training years, my like really when I was figuring out what I was supposed to be doing. But then when private practice started, it sort of chose me that the people who tended to come back, the people who tended to choose me as their therapist, the people who had the best results tended to be women and couples both.
Mm-hmm.
And I found success there. I found that maybe this is where I'm supposed to be. So even though technically it's not where my training was, I don't have a great deal, hardly any training in couples therapy. And women is not something that's really a specific focus when you're saying this is what I want to do as a psychologist. That's who chose me. When I was trying to figure out who do I work best with, it kind of was answered that this is who we think you work best with because this is who keeps showing up on your doorstep, right? And so now the focus has become I still integrate the health psychology, the pain management, the end of life care when needed, but my focus has been women who are going through a life change. And that tends to be sometimes they bring in a spouse when it's marital issues or when it's child issues. But it's women who are debating getting back into the workforce, changing career, going back to school. Do I need to change my relationship? There's something that they've hit, and we try to help them get past that roadblock.
Okay, okay. So it kind of came to you in that sense where you started off thinking you were doing one thing, and then you realized that you maybe were more specialized in another, or people, at least the people that were drawn to you, kind of told you
Right,
who it showed
right.
you what you were better at, right?
Right. And it's interesting. I get to know a lot of people's stories, and that's part of my job, right? I get to hear people's intimate details. And for so many people, so many career professionals, that's how it goes. That I thought I was on path A and I ended up on path W, and that's where I'm happy. So
Yeah.
I stuck with the career, but I've definitely pivoted a couple of times into where I felt the right niche was for me.
All right, cool. Yeah, definitely. I had the same thing with me. I mean, it's you start off thinking one thing and you go through
Yep.
school and then you can totally switch it. You just find out who you like. That's why clinicals are important. That's why that experience is important. But sometimes your patients end up choosing you, which is good because it's like it's a natural ebb and flow. It's the invisible hand of this health career that gets you where you want to be, hopefully.
Well, and
Um,
whether we admit it or not, we're in the it's a people business. You and I are both, you have to interact with somebody. And so it's not purely money, it's not purely function. It's got to be who you jive with. And it's customer care, it's interpersonal skills. And some people you just kind of vibe with better. You
yeah.
get them, they get you. And we need to trust our professionals. It's so many times I've had patients come and they talk to me about their medical professionals, be it a OB-GYN or a PCP or a psychiatrist or whatever. And they'll say, I mean, maybe he's great, maybe she's good, but I just don't like him. I don't feel like they listen. I don't feel like they get me. So there is this kind of matching that I think naturally happens in our fields.
Yeah, definitely. And if you get that kind of feedback from someone, it's usually a sign that maybe you should be working together. So it's good
Right?
that yeah, that we find the correct match. Um,
Sorry.
so you were, whoops, sorry, Siri's talking over here. Let me turn this off.
She can
So
join the
tell me,
conversation.
yeah, right. She has some things to say. She's a woman. She's
That's it.
interested in what you have to offer.
I'm listening. Yeah.
um, so your specialty, like you said, is relationships and women.
Yeah.
And it seems like your experience working kind of led you to that. What are some of the things, specifically in the relationships category, that you can delve into? What are some of the biggest things you see with relationship issues, like maybe in the South Florida region, if that's any different, with relationships?
So I don't know if it's specific to South Florida, but it's definitely the thing that comes up the most is jealousy and infidelity, right? It's typically trust issues, and it may not be that somebody cheated, but it's that I feel like we start getting into some of the gray area of emotional infidelity, of distrust, and even some of the gray area of when does it become abuse versus difficult conversations. So that's a lot of who I end up seeing, because the way that we speak to our partner, to our spouse, it shows a lot. And I mean, if I want to be cheesy but honest, it's typically communication, right? That's what all my
Hmm.
couples need is communication. But
Hmm.
sometimes it's not just you could say that differently to your partner. A lot of times it presents that somebody feels like there's cheating or distrust or infidelity or loss of love or loss of interest. And I'll tell you, it's a real messy thing, because trust is not something you can just create out of the ether. It really comes with time and experience. And the way I explain it to a lot of my couples, it's like when you go into one of those factory floors and you see they have the sign that says, it's been 200 days since our last accident.
Hmm. Yeah.
And that's kind of how it works in your relationship. That if it's been 200 days since your last misstep, since your last foul up, since your last fear that somebody transgressed, the more days go by, the easier it is to go, okay, I'm safe again. I can let my guard down. But when it just happened 2 weeks ago, seeing your therapist doesn't suddenly make that all okay. We've got to rebuild trust and fidelity and faith, right?
Yeah. To me, it always sounds like I've never been involved with anything like that, like with cheating. That just sounds like it would be such a devastating thing to happen to a relationship. Like, I can't imagine, just from my layman perspective, it seemed like it'd be really hard to fix something like that. So I could imagine that that's your job is cut out for you at that point, right?
And what I found fascinating is that it's not easy to fix, but it's very idiosyncratic to the couple. What do you consider cheating? Because some people differ just on that definition. Is it cheating if you text somebody? Is it cheating if you lie about who you had lunch with? Is it cheating if you go to a strip club? Is it cheating if you talk to an ex on Instagram? So a lot of it, we get into just definitions and expectations. But I've been fascinated to see how many couples work past the cheating. And that's something that it's very specific to the couple. There's no magic to make you get past that. You got to really both be willing to do the work. But there's so many factors that get involved. And whether it's getting past cheating or whether it's deciding do we stay together for whatever the reason may be, there's a lot of things that you need to consider, and a lot of what I provide is the space to have that conversation. Because typically when somebody gets cheated on or abused or there's a bad incident or whatever happens, you've got some friends yelling, just leave him, just leave her. And
Yeah.
so, but it's not simple. We've got kids together, we've got a mortgage together, we've got a life together. We had many good years before this thing. And so what I try to do is give the couple the space to say, listen, I'm not judging. I don't decide what you should do. There's no right answer, but let's figure out, without anybody judging, what is the move for you guys, right? And
Yeah,
each couple needs to decide for themselves.
yeah, that's the thing. I think a lot of people involve the family and friends, right? That's a huge thing where it's like, well, I was thinking this, and then you ask for advice from your family or your friends, and they don't. I feel like they don't know the situation so well, so they usually offer pretty polarizing
Yeah.
ideas, right?
Yeah, we
So,
immediately back our person, assume that our person is right. And then the other danger that comes with that is then now if he or she, whoever your partner is, if we mend, then now the family looks at you with the stink eye, right? So it's a
yeah,
real, what I try to provide for whether it's women or the couple is also a place to talk. Because some people have figured out, I can't go tell my family. Now they're going to look at my relationship weird the rest of the time we're together. So I can't tell the people I would usually tell. So where do I put this? And your psychologist is who you tell because you need to talk to somebody. But you can't tell these people or they're going to be biased.
Yeah, some people are big sharers and some people don't want to share stuff with their family. I mean, personally, with my family, I don't want to really share anything with them. I know my mom gives bad advice in my opinion. Hopefully she doesn't watch this episode, but we'll see.
Too many
So she
cooks
has
in
the
the kitchen.
patience.
No, what I tell everybody though is that you need the right type of advice. Your mom can give great advice about a certain topic, but maybe relationships isn't it. So you need to ask the right expert. And I tell my patients, like, listen, you shouldn't bring me your car and tell me it's going ticka 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 because I am not an auto mechanic. But you shouldn't ask your auto mechanic, should I leave my husband? Because they don't know. So it's the key is to ask the right
Yeah.
person the right advice. And too often people ask relationship advice from that friend who's been in bad relationships. So does that friend really know what they're talking about? Maybe they're
Yeah.
not an expert on that field.
It seems like, at least in my generation, the people who are most vocal about relationships and things like that on Instagram and online, because Instagram's where I spend some of my time looking at,
Yeah.
random people posting. Those are the people that are always in, like, I feel like I wouldn't want their advice anyway. They're usually talking about relationships and how they get involved with the wrong people. It's always dramatic. And it's like, why would you? I feel like that wouldn't be the person you want to talk to, but those are usually your friends. And then you might talk to them because you see them always posting about it. And then you might get some advice that comes from like a perspective that might not be the best for you or your relationship.
Well, because what we do as humans is we want to feel connected, we want to feel not alone, we want to feel familiar. So this feels familiar. I just got out of a bad relationship, so did this person on Instagram. So we can relate. And it's nice to feel related to, but if you're trying to make choices, you want to ask somebody who's been in a healthy relationship or who found a partner after 10 years of being single. That's whose advice you want. You don't want advice from the person who's stuck in the same spot. You want to commiserate, but sometimes we confuse that commiserating, hey, you're like me, with, oh, I should do what you do, right? And so that's kind of the trick, is understanding the two different phases.
Yeah, I can imagine that's probably, and that's something that a lot of people themselves wouldn't be qualified to take care of themselves with. I'm assuming they would probably make that. That's why you probably want someone like that's qualified to step in because people on their own they don't always make the best decisions, as we know. I know that with PT at least. I'm
Yeah.
sure that you know that with your profession.
Oh, yeah.
So that's the couples aspect. What about women's issues? So you said that women kind of ended up, the women in the couple concept gravitated to you in your practice.
Hmm.
What do you, what about women drove them to you, and what are some common issues maybe the listeners would, like a female listener would come across as a woman? What's the most common thing that you're seeing?
So yeah, what I try to provide, and I'm not always, I don't claim to be perfect at it, but what I try to provide is that I can, when I'm talking to heterosexual women and couples, I can provide a little bit of both sides because I understand women's viewpoint, but then I can talk as the man in the room. So a lot of
Hmm.
what I do with my women is say, if I were your husband, I could imagine feeling this way in reaction to what you just said. If I were your son, your brother, your father, so, and I deal with a large age range. So there's some younger women who are in their early 20s who will say, listen, I don't like the way your dad spoke to you. If I was your dad, I would try to say this. And maybe you still don't like the thing I said, but I'm trying to give you a different perspective of what a dad might feel for his daughter. So I try to give that male perspective, but I'm not your dad. I'm not your husband. So we can role play some things. We can run through some scenarios. We can do it in a non-contentious area. And I mean, I'm just one guy's opinion. I don't represent all men, but at least it's somebody who you don't have a sexual relationship with, you don't have a familial relationship with. So it removes those complications and we can have that male-female dialogue. And that's a lot of what I provide. What I find with that, though, is that so many women will write down on the intake form, I'm coming in for X, Y, or Z issue. And then after about 20 minutes of the initial session, we finally get to, and yeah, I've got some relationship stuff going on. So it's always relationships and it may not be romantic relationships. It may not be with the guy in your life. It might be with your sister or your coworker, but we are our relationships, and women more than men are more vocal about working through the relationship. And so that tends to be what ends up happening is that, like I said at the beginning, I talked to a lot of women about that phase transition. Do I need to make choice A or choice B? And again, while I don't make the choice for them, we talk it through in an open forum to help you come to what feels like the right choice for you with no judgment. But those choices so often center around your relationships. Anxiety about a relationship, fear about a relationship, self-judgment from something somebody said to me in a relationship. So it's sort of disentangling that who are you versus your relationships. And at the core, what I really try to do is help women find the who am I at my core. If nobody's looking, if nobody's judging, if Instagram's turned off, if my family's not giving their feedback, then who am I truly?
Yeah, and so you're mentioning the communication aspect, and girls. I feel like everyone thinks that women are better at expressing it, and it seems like you might agree with that. So, what is it with guys that that they sometimes just let things passively go by, and they're worse at communication? Is it the way that society is, or the way that they're raised?
I think you're hitting it right there. Yeah. I mean, I think it's this expectation that, I mean, going back to like the most basic, most core macho kind of like a girl's crying and people say what's wrong, and a boy's crying and they say, suck it up, stop crying.
Yeah.
Right. So at a very young age, boys are not taught to express feelings, use feeling words. Boys are taught that the acceptable feeling is to be angry. So it's interesting because, I mean, I'm a grown man and I am a psychologist, but if I stub my toe, my immediate reaction is to kind of growl with anger
Yeah.
and hold it in. And my wife will immediately start crying, which if I think about it, that really hurt. I would like to cry also, but I'm so wired that you don't cry, you get mad and you punch the thing that hurt you. And it's, we're trained in this way, but it's also that men don't talk with men. If you put 3 women in a room, there will be so many vocabulary words that come out, so much dialogue. And my wife, she laughs because I'll get together with my buddies for social distancing happy hour and she'll say, how's everybody doing? And I go, I don't know. And she'll ask, how's this one's marriage? I'm like, it didn't come up. How's this one's kids? We never talked about it. Like, we just talked about stuff. We interacted as men, but I didn't ask real questions.
Yeah.
And one time she even said, why didn't you ask about so-and-so's marriage? Like, isn't it a struggle? Did they get divorced? And I was like, well, we didn't want to ruin the moment, right? We were having fun. So I didn't want to like bring it down. But a woman would immediately turn to her friend and be like, oh my God, Charlotte, how's your marriage? Like, I'm concerned about you. That's the most important pressing thing. And so I think men, we just, even when we're locked in a room alone and there's nobody looking, we don't go to that dialogue, that communication amongst even other men. Right?
Yeah, that's funny. That's so true. It's like these things that you take for granted. When you're saying that stuff, I'm like, that's so true. I wouldn't ask those questions to my buddies ever. Like, I wouldn't even consider that.
I even teach women how to talk to men. How do you talk to your spouse? Like, you don't look them in the eye and say, I think we should talk. I tell them what you should do is sit shoulder to shoulder, hip to hip. And while we're watching TV, don't ever make eye contact. Don't turn. Just look right at the screen and say, hey, man, how you feeling about your brother's death? And don't look at him and don't let him look at you. And then he'll be like, yeah, it sucks. And you can be like, you good? Yeah, you good. And that's how you talk to your man. Like, you don't turn and look at me in the eye, because now I'm going to feel like, oh my, it's too much intimacy. So even with your spouse, or I teach that you should talk in bed, lay in the darkness and stare at the ceiling and talk, because then you don't need to see, what if I cry? I don't want you to see me cry. I'm a man, but maybe I need to cry in the darkness of the bedroom so you didn't see it. And I can be just, as cutting onions in here. So it's definitely this stereotypical behavior that, I don't know if it's nature or nurture, but it's definitely what men and women are sort of pressed into.
Yeah, that's so true. Those probably would be effective techniques. I'm thinking of all the times a guy has like approached me directly on, and you're always, it's like my innate instinct, like, what the hell are you doing, man? Like,
right. Yeah. What's your angle? It feels weird. Yeah.
It's like this defensive posture you take. And the thing with you stubbing your toe is so funny. I've had things where I've stubbed my foot on something, or like I always hit my freaking shin on the side of the bed, and I get so mad. And it's like, you don't see girls do that much. They're disappointed. They're sad about it. So is there like a better, do you think that the way women do it is the correct way, or that there's something in between, or that guys are wrong, or like, is that a weird question? Like, are girls?
I see what you're asking.
Yeah. Because could they be too, saddened by things when they shouldn't be, or this could be a sketchy question.
And I'm going to answer it irrespective of gender. I will say that there's some research that shows that people who withhold their emotions can be, so you've heard of people saying that somebody's type A, right? You're type A personality. You're very rigid. You're very like neurotic. Well, type A people tend to be a little bit more angry also, a little bit more like, why is traffic this way? What? And so type A people are prone to more anger, aggression, expression of frustration, they tend to have more heart disease. Type B people are very passive. They may not be successful in life, but they have good health. They're very just like go with the flow.
Yeah.
Type C is this other personality where there's no expression. I don't show anger. I don't show sadness. I'm just very withdrawn. And type C stands for cancer prone. There's some evidence, and none of it's like A leads to Z directly, but there's some evidence that if you hold in all your emotions, it might manifest as cancer cell growth.
Mm-hmm.
And that's not a direct correlation, but it's there in the evidence. So what I'm saying is, at a health level, at a physiologic level, too much expression of anger is bad, and too little expression of emotion is bad for your health. And so my answer to everything is always gray.
Yeah.
And what do we need? Men should express a little bit more articulately and a little bit more clearly, but sometimes women go too much into it and get lost in the emotions, and the stereotype becomes, why are you still crying over your ex from 3 years ago? Right?
Mm-hmm.
But then what I would say to the guy in this made up scenario is, why have you not cried about your brother's death yet? So if you take those like polar opposites, men could show a little bit more, but some women get too caught up in the feelings, and the feelings are misconstrued for reality at times.
So if guys, yeah.
Yeah, go.
No, I was just going off that. So, like, if you're a guy and you tend not to show much emotion over things, like you're not sad about things a lot, like, is that something that you would say probably needs to be fixed? Or, like, what if they live their whole life and they're just known as this, like, stoic man? Like, is that a bad thing, or, or is that something that should be...
Everybody expresses differently, right?
Mm-hmm.
So what I always think about when I get into this is that, and especially with my couples, that there's different ways of saying the same thing. So there's a Parks and Recreation episode where Andy and April are professing their love, and April says, "I love you," and Andy says, "Awesome sauce." And at the very end of the episode, it's pointed out that awesome sauce is his version of saying "I love you." That's yes, he didn't say "I love you," but don't you understand that that's what he was trying to say?
Yeah.
Now, he could have said it better. And so sometimes what we need to look at is the stoic man. If he turns to you and says, "Good to see you, man," that to him might be his version of, "I've missed you and longed for you, and it's been ages," right? So we need to kind of consider the person's context, that not everybody needs to express the same, but relative to your baseline, when something abnormal happens, you should have a upswell of expression, right?
Mm-hmm.
And yeah.
No, I was gonna say, do you think that there's like a genetic component, like a nurture versus nature thing? Maybe men are just like genetically wired to be less emotional, like outwardly emotional about things, or is this really like the way that we're socialized?
So the answer is yes, both. Because the evolutionary psychology says that men were taught to be the hunters out in the hunting party. And so you need to communicate quietly and through grunts. Otherwise, you will scare the prey. And men are taught to spend long periods being alone and quiet together. But so long as I know you're there and I can kind of feel your shoulder touching mine, we're cool. And women are taught to stay at the cave and raise the children. Mm-hmm. And they need to be able to communicate, "Hey, can you watch my kid while I go pick berries?" Mm-hmm. And so being able to clearly say, "I need you to watch my kid while I pick berries, otherwise the lion's going to eat the kid." So if you go way back into our evolutionary programming, there's that. But then societally, you see different cultures. There's a lot of interesting research about different cultures, both your culture of origin in terms of like where you grew up, your culture of your family, and your ethnic background, and all speak to different ways of expressing emotion and what is kind of planned into you, what is programmed. If you go, I'm stereotyping, but it's based in truth, so I don't mean any ill harm, but if you go to a funeral in the British countryside, it's going to be very stoic. If you go to a funeral with a Black community in Atlanta, it's going to be very expressive. And neither one is right or wrong, but it's what's idiosyncratic to that culture and what is shown as acceptable behavior or expected behavior, right?
Yeah, that totally makes sense. I mean, we can think already. Like, I'm Ukrainian, and I see a lot of Eastern Europeans. I have some patients that are Eastern Euros. Sometimes, in Miami that'll happen, but they definitely have a different way of expressing themselves, the girls and the boys, as opposed to someone that might be from like Central America, Dominican Republic, Haiti. Like, they all have their different ways of expressing it, and it's kind of funny because you start picking up on trends. You try not to let it affect
Yeah.
you way you treat them, of course.
No, but you
But
need to know.
even the things they say, like I'll be hurting someone and they'll be like, "Wow, wow." It's like for some reason I think my North Miami patients tend to be like that, where it's like they'll say "wow" instead of. I'm like, are they like impressed by the pain, or are they actually in severe pain right now? So
Right.
you got to clear things up with people because it's you just got to learn what they're like. So
Well,
I
in
could see the cultural aspect.
pain management, which overlaps for both of us. Again, I did
Yeah.
that for many years.
Mm-hmm.
There's both a difference in how certain genetic background and ethnic background experiences pain. Like truly, pain tolerance is different for black versus white men, different for redheads, different obviously for men versus women.
Mm-hmm.
And so there's a baseline pain tolerance that's different for different people and genders. And there's also a different pain expression. And so being able to understand that a black man versus a white redheaded female, they might both be experiencing a 7 out of 10 pain, but the way they vocalize it is going to be different. And so we need to understand, well, how much meds or what do we need there, you know?
Yeah, working with that. Now, you brought up a good point. This is like a totally, you've probably been asked this question a lot, but when you say men versus women and pain tolerance, there's a lot of people saying a lot of stuff out there. What is your take on that in terms of how much pain a woman and man can tolerate? In my experience, it seems like if you look at something like a knee replacement, which is the most aggressive musculoskeletal procedure, one of the most
Mm-hmm.
aggressive that I see in the clinic, it
Mm-hmm.
looks to me, it seems like guys usually have it worse. Like they deal with it a little bit less well, and they'll do it in the way that you're talking about, which is like they're angry, like "Ugh, ugh." But
Right.
women, I mean, there's this theory that women like, oh, they're weak, they can't handle pain, but then I think that women can handle more pain in that sense, and they give birth, and that seems like the most painful thing in the world. So, what have you learned, at least about pain psychology in men versus women?
And so I haven't read the latest research. I've trended away from pain psychology, but
Yeah.
where I left off and what I've seen, anecdotally, what happens is with acute injury, acute pain, men do better. So the stubbing the toe, right? I can
Mm-hmm.
stub my toe and not drop my glass of water, but my wife will fall down and crumble. The sudden acute onset, men do better with that. And so imagine, I don't know, a boxing match, or imagine a car accident, or banging your shin. So in that, if you've got 8 seconds to reply, men do better. But chronic pain, ongoing pain, unremitting pain, rehab pain, pain through hours of labor, women go far and above of being able to tolerate.
Yeah.
And what I think this comes down to, some of it is physiologic in the way that women are made to be able to tolerate these things.
Mm-hmm.
Um, I mean, imagine if men had a 10-month gestation period, right? Like if for 10 months your hip bones had to expand and your chest hurt and all, like men would not do well with it. But women, even if you've never been pregnant, even if pregnancy is not a normal course of thing for you, your body knows how to handle it. And I think this comes from women getting their period. I really think that women at the age of menarche all the way until menopause, right? Women know that every month, to varying degrees for each woman's, physiology, you're going to have 7 to 10, depending, days of discomfort. And it may not be pain per se, but you're going to have this chronic, repetitive, cyclic discomfort in your
Yeah.
body. And the first few months a girl gets her period, it's psychologically and physically a lot, understandably. But women just go on about their day. Women know that I'm getting my period, or I'm about to get my period, and I'm not great. I'm not 100%, but I'm going to carry on. And so women are taught and trained through the way our culture is that you don't get to take a break because you're getting your period. And so they
Mm-hmm.
know how to just plow through. I'm either going to take meds, or I'm going to ignore it, or I'm going to. But again, a man, this is where women joke about the man flu or a man cold, that I'm used to feeling 100% all the time. So if I drop 10%, if physiologically I'm 10% off my game,
Yeah.
I feel like we should take a break. I should go to the ER because I'm not used to discomfort. It's not okay, right? So
Yeah.
when it comes to pain, I think women are indoctrinated into pain.
Yeah, sometimes I'm amazed that girls on when they have their time of the month, I'm like, how are they existing right now? If that happened to me, I would be like, this is this is devastating. I'm not doing anything. Of course, it'd be totally unexpected because I'm a guy, but it would freak me out if it was just. It's part of the culture, though. You got to move on and deal with it, I guess, right?
Yeah.
So, now, um, this is kind of a left field question here, but
Hmm.
well, not really. It's pertinent, but I don't know if it means anything. So coronavirus, the whole COVID thing, everyone's cooped up inside. Couples are forced together. People are spending more time around each other. The guys are taking different roles in the house, I'm assuming. Have you noticed any kind of changes in the types of patients coming to you lately because of coronavirus?
So it's interesting. I haven't. It's not a change per se, right?
Mm-hmm.
A lot of the concern people have had for me is, or do you get a lot of people with OCD who are popping up more now, germaphobes, right?
Yeah.
And I haven't had more on my caseload, but there's definitely some people who their anxiety has jumped from worrying about this to now worrying about coronavirus. And some anxiety is global; it's not specific. Some fears and panic can kind of jump from this specific concern to this one. So I'm seeing that. I'm seeing that it's generally this extra stressor, right? And so if you imagine that all of us are at some kind of baseline, that we're all bopping along at a 7 out of 10 happiness scale, well, everybody globally has taken 1 or 2 points of a hit, but it
Yeah.
hits some people differently because maybe I'm starting at a 7 out of 10, but you are already at a 4 out of 10. And so
Mm-hmm.
if I get knocked down 2 notches, I'm still at 5 out of 10. I'm okay. But now you're underwater. Now you're at 2 out of 10. So a
Yeah.
lot of people who are kind of doing okay are suddenly not doing okay because they've been suppressed, right? There's this other stressor and it's not going away anytime soon. And then the other thing I'm seeing is some weird dynamics with couples. Not necessarily at couples because they're cooped up that it's changing, but I've had at least 2 couples that reconnected because they needed somebody to quarantine with that they trusted.
Oh.
So we're broken up with, but now we're living together. I
Yeah.
had I have had 3 relationships start in quarantine and say, well, you got tested and I got tested, so now let's just hang out in my apartment for 3 weeks and see if this jives before you
Mm-hmm.
leave. So there's been some weird sort of
Yeah.
quarantine dynamics that I don't know that I would have voted for, but we're working through it,
Yeah, no one wants to vote for coronavirus, but there are
right?
some. Seems like there are some. That's what I figured. I was like, there's got to be some kind of coronavirus impact on your job. So, um, all
No,
right.
that's the
So,
biggest thing. And what I'm letting people know
yeah.
is that you're depression is a hard term to use because there's so many, it's on a scale, it's on a spectrum, but
Hmm.
like you don't need to think of yourself as depressed, but you need to think of all of us as suffering. And so this is what we would call in most cases an adjustment disorder, that if I remove the stressor, if I take my thumb off of you, if coronavirus goes away, then you're going to feel better. But right now, while we're in it, you're not doing so great. So we need to address the symptoms of the moment as though they are real, as though they are yours, but we also need to not personify them and say, whoa, I'm a failure, or I'm weak because I need antidepressants or therapy, or I'm not doing well. Dude, nobody's doing well. So everybody
Yeah.
like depersonalize it. Don't take it like it's a failure of yours, but take care of it. And so I give, I'm sure you've given this analogy before, but I give the broken leg analogy that like, you don't need to tough it out. Dude, if you got a broken leg, slap on some crutches. I'm not saying you're going to use crutches forever, but right
Hmm.
now, use the crutches, man. And so right now, everybody needs their crutch of whatever it is. And you may not need therapy. Maybe you just need to eat a little extra ice cream or let yourself sleep in on the weekends
Yeah.
or reconnect with your ex, even though you know it's a bad idea, but I need something right now. And
Hmm.
so then when Corona lifts, then we're going to do a lot of reevaluating of, okay, now let's make that change. Let's get back to baseline, you know?
Yeah, definitely. I mean, it seems the coronavirus just seems like like it's a constant weight. Even if everything's good, you think about the fact that there's this world pandemic going on and
Mm-hmm.
things are closed, and you start thinking about the economy, and then it's like it's always hanging over you. So that's what I was thinking. Like I feel like people are probably constantly held back by that.
And that's the biggest thing that I am seeing that I should say that has changed is that
Yeah.
people who used to cope through going to the gym can't. People used to cope by going to happy hour can't. People used to cope by going to the movies and escaping can't. People used to cope by traveling can't. People used to cope by going to church can't. So a lot of your typical
Yeah.
coping skills have now been removed. A lot of my extroverts are doing terribly
Oh
because
God.
I'm
Yeah.
used to being around people and now I can't. And so that's the big thing that you were doing fine with your life because you had your typical coping skills, but now I just yanked away 90% of them. So now what do you do?
Yeah, the gyms being closed is terrible. And they were gonna shut them down again, and I was like, what am I gonna do with my life? I was so depressed about it because I just spent 3 months using kettlebells. I had these two stupid kettlebells I used, and I learned a lot of cool exercises, but I was just like shrinking and shrinking. And I want to stay big, so it was really stressful for me.
So I'm going to give a plug here. There's a website I have no connection to, but I pitch this to all my patients. I have no idea
Mm-hmm.
why it's called this. It's called DareBee, DareBee. I don't know. I stumbled upon it like 10 years ago. But what
Yeah.
it does is it gives you printable 8.5 by 11 posters, kind of like you used to see in old school gyms, like the
Yeah.
old timey. And it would be a poster on the wall of do these exercises with like the strong man and poses. And so this group puts together these things and they'll say, this is if you're a novice. This is if you have kettlebells. This is if you want to do
Mm-hmm.
abs. This is
Oh,
if you want to
cool.
do butt bluster. And so, but most of them don't require a gym or equipment. So I pitch this to all my patients who say they don't have access to gyms or they don't have time because they're working moms or because they don't have finances. So even before Corona, I'm like, listen, do a chair squat against the wall for 3 minutes. Then go do a plank for 3 minutes. Then do jumping jacks for 3 minutes. You're good, man. You don't need to go to a gym. I mean, for you, you're a buff guy. So to maintain your bulk, you would. But if you want to stay in good fitness, you don't need anything. You can do this in your living room at 2 a.m. So you're still getting that heart rate up. You're still getting that sweat and that pump. But we're using just body weight and some complex exercises. And
There you go,
I'm a big fan.
darebee.com, everyone.
Darebee.com,
Darebee.
man. Yeah,
I
man.
like so now
Free.
that we're plugging stuff, let's start plugging you, man. Let's find out
All
a little
right.
bit about you. So one of the one of the things I was looking up was this Dr. G method. Can you explain the Dr. G method to me?
So yeah, it's people ask, they do some research and they've got a psychology background and they want to know what techniques do you use, what theory do you work from? Because in psychology there's different theories. Like most people know the Freudian type of theory,
Mm-hmm.
that method of going, tell me about your mother. But what's very popular right now is cognitive behavioral therapy because that's the one that's the most researched and it's the one that insurance companies want to know that you do. But cognitive behavioral therapy, in my opinion, is a little bit stiff.
Mm-hmm.
It's a lot of workbooks. It's a lot of step one, step two. And I don't find that works for my personality and for my patients. So the Dr. G method is hard to sum up in a few bullet points, which is why I wrote this whole webpage. But I want people to understand what they're buying, that you're the customer and you need to know this is what you're going to get. Like part of the Dr. G method is that I will talk about myself. And not all psychologists do that. Not all therapists do that. That sometimes can startle people. But I think it helps if you feel like I'm another person in the room and we interact. I think it's, in my professional opinion, it doesn't work if I sit like the man on the throne and I just dictate what to do.
Mm-hmm.
That works for a lot of professionals and a lot of customers. And so I'm letting you know this is what you're buying. And I say fuck and shit a lot. And that is off putting to some patients. But we talk about sex a lot in my sessions. And I need you to feel comfortable using whatever language you want and feeling like we can just be real. If you come in and you're upset about your life and you want to say, what the fuck, you're allowed. You don't need to censor yourself. I'm not your granddad. I'm not your boss. So it's okay. And so this is not a method that you would learn in school, right? But I'm also not making it up because there's a lot of snake oil salesmen in the field of coaching or mental health, or they put themselves out there, these kind of vague terms that they will be your guide, and they're just making it up. And it can quickly slippery slope into like the creepy guy who thinks he needs to sleep with his patients to cure them, or somebody coming
Oh
up with these
God.
bizarre methods of like,
Mm-hmm.
we need to go take a hike in the jungle and you need to face death. Like some of this stuff is just extreme, and some person had a crazy idea. My stuff is based in, I have a PhD, I have research training, I have been
Yeah.
trained in clinical settings. So I know that this is not gobbledygook, but I've
Yeah.
tried to put my personal spin on it to show what fits me because I can't be not me, right? There's not a professional side of me. I put on a nicer shirt and I use bigger words, but I'm still me. And so
Yeah.
this is what you're getting. You're getting a human interaction. And that's, I mean, the Dr. G method's a little bit more complicated than that, but that's what it comes down to is I want you to know who I am and how I'm going to be with you in the room. And if that ain't for you, that's cool, but I can't really be not me, right?
Yeah, I was looking through on your website. I was looking through your Dr. G method, some of the bullet points you had, and I was like, okay, this is good stuff. This is kind of like akin to me as a physical therapist having different modalities that I use and different techniques that I do it with without being that body work person that has some weird like we're gonna rub THC into your earlobes. Like it's not like that's not what it's about. Like you're
Right.
just operating within your PhD, and you have your own methods that work, and they're unique to you. So that's really good.
But
And
it's
I remember
also
when
moving with. I'm sorry. Go. Go.
no,
Go.
I was like saying when I was starting my Instagram, I remember you telling me specifically to show more of me in my videos because people want to connect with you as a person, and just like you know, you use the swear words, you talk about yourself, which I think I would like too. I wouldn't want to be talking to some stiff board in the wall.
But some people feel comfortable with it. Some
Yeah, true.
people. Um, I mean, it's funny. I'm going to contradict myself, but I've seen many therapists over the years, and I had one who she shared a little bit too much personal with me, and I told her like, please, no, thank you. Like, I appreciate that you trust me. Maybe you know I'm also a peer professional, so you feel like, but I need you to keep it together. I
Okay.
need you to be just clean, and I don't want to worry about you in the room. And maybe it's because of my career, but I felt like I don't want to know your stuff because it's going to make me think, is she okay? Do I need to check on her today?
Uh,
So I
the
needed her to be a
empathy
little bit
kicks
more,
in.
yeah. So you need to know who you are and who you're matching with. It's very much a match.
So okay, so on this topic here, you have something called the 360 health assessment. It involves like health and holistic psychology. Can you explain that for me a little bit?
Right. So I've tried to find the right language that's translatable to customers, to clients, to patients. How do you understand what I'm doing? And like I said, the Dr. G method is one attempt, but the 360 health assessment is an attempt to try to understand that I'm not just your mental doctor, right? That's what I'm trained in, and that's the only thing that I'm going to do kind of with you and to you. But we need to talk about
Hmm.
all the other holistic aspects of the whole person. And I think it's not really useful if we only talk about your mood. If I only ask, how's your anxiety level? Again, that's what a lot of people expect from a mental health provider. That's what a lot of mental health providers do. I'm not maligning that. That doesn't mean it's bad. But what Dr. Giardina tries to do is to say, listen, I need to know from Jump Street, I need to know what medications you're on, and not just the psych ones. I need to know all of them. And I've learned a lot of psychopharmacology and a lot of general pharmacology. I can't prescribe, and I'm not going to be the one to tell you to change your dosage. That's not in my wheelhouse. But I need to know what meds you're on because I know the side effects might lead to such and such. Like for instance, if you're taking steroids, like like anabolic steroids, but steroids to
Hmm.
treat an infection, that can cause anxiety and sleeplessness and
Hmm.
agitation. I know that. And then if you come in and say I'm anxious, I'm going to ask, well, you're taking the steroidal compound, plus you're drinking 3 caffeinated beverages. There's your anxiety. Remove those and let's see what happens. Like I said, with women, I track your cycle. I want to understand what's happening for you hormonally. Are you on birth control? Are you pregnant? Are you menopausal? That matters. I need to understand where you're coming from spiritually. I need to know, are we talking about God? Are we talking about faith? Do you have a community that's important to you? Do you have a sense of meaning that comes from spirituality? That's going to be factored into how we help you cope. I need to know what you're doing physically, like physical health, because if you've got thyroid issues or if you're taking hormones for IVF, there's things that are going to affect your mood and your behavior. I need to know what your behaviors are because there's a lot of repetitive behaviors that affect your mood. And it's hard to change your mood, but it's easier to change your behaviors and say, wow, you keep getting drunk on Fridays and then being hungover on Saturday, and then that translates into Sunday. And so that's
Hmm.
why your weekends are turning crappy. So that's affecting your mood, it's affecting your productivity, it's affecting your weight and your health. Let's look at that pattern, that habit. So what I try to do is look at all these different kind of pieces around the 360-degree circle, and it's different for each person. But if I don't ask those questions, then I'm missing part of the whole. Then I'm just saying, while you're sad, but sadness could come from so many different sources, and it's going to change so much how we treat it, we change it, we help it. Right. So I try to get that whole piece in the dialogue, and it's a lot to take in the first hour, and it's a lot to stay on track because next session you think we're going to talk about your relationship, and we end up talking about your health condition when you were 20, but that's an important part of your narrative. And so we try to put it all in there, and it's a lot, but you're a lot. You're complicated.
Exactly.
Does that make
That's the
sense?
yeah. No, that's the important part about being a PhD. It sounds like because you have the knowledge base to address something from a pharmacological level, biological, socio, like all these things that contribute. You're incorporating because your curriculum and the things that you studied through school, provide you with that. It's not like it would be like someone going to a personal trainer if they had an injury and you need someone that actually can address everything. So you go to like a doctor, physical therapy, or like a physician, orthopedic surgeon or something, because they can look at the holistic view. And it's good here that you have, because with the psychology component, it's like obviously I have no idea how I would address that for someone because that's not what I do,
Right.
but I could see that becoming very, like, without having a 360 health assessment like that. I could see where it could become a mess where they go to a certain practitioner that they just look at, like, oh, how do you feel about that, and like they don't look at the maybe the other contributing factors. So it would be really important to look at the whole.
Well, then going deeper, right? Like thinking of physical therapy, right? Like right now, I've got this weird thing that happens in my neck. Now, I have no doubt that if I put some Bengay on there and got a good massage, it would feel better. Okay. But it keeps happening. And
Hmm.
so I need a DPT to understand, to really palpate, to get in there, to understand the muscles and the nerve endings and tell me, what is this? Is it ergonomics? Is it my genetics? Is it an old injury? And so you're going to be able to answer that differently because you're asking all these questions. Whereas my massage therapist is going to make me feel great. Okay. But then we never really figured out what was happening.
Exactly.
Right.
Yeah. Oh yeah. You gotta let me know about that again. I think you've had this for a while, haven't you?
No, there's a new injury.
Okay.
The
I
other
think I
one went
remember you
away.
contacting me with, yeah, it might have been a shoulder thing. I forgot, but
Yeah, I had an elbow thing, now I got a shoulder thing.
elbow
It's what
thing.
happens.
Yeah.
It's old age. I'm
I
41.
hope I helped you. I just was like via text. I'll have to actually treat you someday. No worries. So let me tell the listeners where they can find you, all that
Right.
good stuff. Because your Instagram is entertaining to me, and I'm a layman. I mean, I think it's cool. You like sometimes you talk about things that are kind of in the social sphere that people are talking about, like the entanglement thing with Will Smith. I think I saw you post something about that. So you have an interesting Instagram. Tell us about the Instagram, the website, how people can reach you.
Right. So the Instagram is Dr. Todd Giardina. It's DrToddGiardina. That's also the website, drtoddgiardina.com. You can also find me at coralgablescounseling.com. And I'm
Hmm.
part of the Coral Gables Counseling Center. We're located off of 37th Avenue and Coral Way in the Bank of America building. Right now, we're not in person. It's all remote telehealth until COVID clears, because doing therapy when we both have masks on has been pretty prohibitive. So at least this way I
Yeah.
can see you face, you can hear me clearly. Um, I take a little bit of insurance. It's mostly fee for service. Insurance messes up the patient and the provider, so we're trying to get away from that. And as I said, I work with a team. So what's important is, even if you heard something that today on this podcast that I can be helpful with, obviously I want to speak with you. But there's other pieces that I can't treat, and we've got people in my office who can do whatever would be needed, who treat kids, who treat older adults, who work with families, who can test your kids. We have a psychiatrist one day a week, so we try to cover it all. And
Okay, good.
yeah,
Yeah, I
sorry,
will.
I'm
I
terrible at
will.
marketing myself.
I was like, well, the one thing that he hasn't like expanded on. I mean, I'm like that too. It's when you're marketing yourself, it's tough because you're like, you
I'm
sometimes
like,
you need
this is what
someone
I
else
do.
to build you up. Like
Yeah,
this guy's awesome. I mean, I met you through that Bumble Biz thing. Well,
Bumble
you're the
Biz.
only
Yeah,
person I ever met through Bumble Biz, and so you're proactive. You. I mean, when I met with you, I met in your office. It was a very comfortable office. I felt really good. And
thank you.
I mean, you're the only real psychologist at this point that I know and follow in the Miami region, and I've heard great things too.
Hmm,
So people,
good.
please check him out. And so drtoddgiardina.com, his Instagram is also Dr. Todd Giardina, always posting cool stuff. And it seems like you're always willing to help. So if Instagram's your thing, feel free. It seems like to message you would be okay. Now I'm just
Hmm.
telling people to harass you. And then you can
No,
check
that's
out his
fine.
website. His website goes over all the things that you could possibly, like, all the frequently asked questions you might have
Hmm.
for Todd. So check him out. Is there anything else that we missed today that
Well, I
you
should
might want
say
to
that
mention?
when Corona is not going on,
Mm-hmm.
I tend to do seminars and talks and workshops, and obviously that's all shut down right now. And I've thought about doing it remote, but I like to interact with people in the room in
Mm-hmm.
person. So once the smoke clears and the dust settles, we'll be going back to that. And so that's something to look forward to. I love doing that. The group in person dynamic. I think it's fun to get people meeting each other. It really helps to have the Q&A and like and pick my brain and let's have this dialogue, kind of like what we're doing here, but with people in the room who who have similar concerns. So that'll be something to keep an eye out for. I really like doing those kind of workshops and talks. It gets me excited. I think it gets people a chance to sample something that is usually kind of hidden in the closet. You don't usually get to meet a psychologist and just chat with them.
Yeah.
So that's to be TBD, but that's out there.
Yeah, and just for the listeners to know, I had written out some questions just to warn Dr. Todd here, and I basically didn't ask half of them, and most of my questions were off the top of my head. So it's not like he was prepared for any of these. So I imagine that your public speaking is pretty good too, because you got really in depth and had some interesting things to talk about with no warning. So yeah, and I've seen some of your engagements, like the Fisher Island club
Yep.
that you went to. So, and that makes perfect sense. You have these communities living together, and they're like they're very loose knit, but I mean, like they're still kind of like families that you want to
Hmm.
at least
Hmm.
engage with. So, yeah, so definitely look into that too for Dr. Todd. Any kind of public engagements or speaking things that you'd be interested in, because man, a psychologist, that's like the perfect. Because I always try to do these like events where I teach people things, and with PT, it's great in gyms and such.
Hmm. Of
But
course.
people could use you for like a lot of things. They could use a psychologist at any kind of like a gym, any facility where people live. Like I feel like you would be a great like
Thank you.
any kind of psychologist, because people don't address that stuff. Like that's the theme of the show. I feel like people really don't address some of their psychological needs and things. So so listeners, if you have any issues, check them out. And this is Dr. Rob Polizek with Physiologics with HealthCast 305. Thanks very much, Dr.
Thank you for having
Todd.
me.
If you ever have time in the future, I'd love to have you on more, because I feel like I could really talk about even one subject forever if I just keep asking you questions, and you're really good at answering questions. So I
Thank
would, I would probably go on a rant myself, but we gotta go. But thank you very much, and have a good day.
Thank you.
Thanks everyone for listening. Adios.
Cheers.